Our webinar, ITENF Healthcare Solutions, is proud to present Submitting 2018 MIPS Data using NextGen HQM. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for ITENF. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of that along with the slides and recording within the next week. Next, for those of you who aren't familiar with ITENF, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we also have some add-on productivity solutions for next-gen, ChartGuard, and Refund Manager. Next, I wanted to mention that we're taking requests for upcoming webinar topics. So if there's a subject you're interested in learning more about, please let us know. If it's next-gen related, regulations related, we're open to suggestions. Let us know and use the questions box or shoot me an email at cgrover@itenf.com. Okay, so back to today's webinar on MIPS and using NextGen HQM. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can use the questions panel in the webinar control panel and type them whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So, without further delay, I'd like to introduce our presenter for today. Usually I have a bunch of people to introduce, but today we only need to introduce Lindsay Lanning because she truly is the expert in the field. She is the Industry Affairs Manager at ITENF Healthcare Solutions. So, Lindsay, the webinar is all yours. Feel free to get started when you're ready.
Great. Well, thank you, Chelsea, and hi, everyone. Thank you for joining us today for our webinar on submitting 2018 MIPS data using NextGen HQM. So let's go ahead and get started. I wanted to point out here, if you are responsible for your practice's quality reporting and MIPS data, what I'm finding after talking to a lot of you and assisting clients is that most likely this isn't your full-time job, and it has been entrusted to you to figure out the program and how to report on your own. So understandably, you may be feeling a bit overwhelmed and not sure how you can track or even submit your data to CMS. So don't worry, we are here to help. With this webinar today, we're going to provide an overview of the NextGen Health Quality Measures web portal, or the HQM, and its functionality and updates. We're going to walk you through the submission process start to finish and identify some of those new portal features that make submitting data even easier than 2017 last year. We will also provide lessons learned through our experience with the 2018 submission process and point out some common pitfalls and how to avoid them. So what we're really trying to say is that we understand the complexities surrounding this program and the impact it can have on your practice. Not only your practice's bottom line, but also your reputation, which is why we want to help make this process as easy as possible for you and also get you guys the highest composite score possible. So let's go ahead and just jump right into it by asking the most basic question there is. What is NextGen HQM? And I know there are many MIPS veterans on the call looking at the attendee list here, so bear with me. I just want to make sure we're all on equal footing before we jump into the submission process because there are some updates for 2018 that are important. But the NextGen Health Quality Measures is a clinical data repository, and it's used for registry reporting of clinical outcomes and quality measure data. So the NextGen HQM actually extracts patient data from the NextGen report server to allow report generation for performance-based incentive programs. So some of those programs include accountable care organizations, ASCs, CBC+, Medicaid meaningful use, and of course MIPS reporting. What is also very nice is that the NextGen HQM is actually a registry and a data submission vendor, which means they can actually submit data for 3 of those MIPS categories. And of all those programs that the HQM has the capability to extract and track data on, MIPS reporting is what we will be exclusively looking at today. Now, I don't plan on going over the requirements under MIPS or the program itself as I have in previous webinars. I usually find ways to sneak little facts and tidbits in about those throughout the webinar if you know me. But today we are strictly looking at how the HQM can facilitate the submission of MIPS data to CMS for 2018, including all those tips and tricks I've learned from probably helping about over 20 to 25 clients and counting submit for this year alone. But let's not get ahead of ourselves here. For the next few slides, I'm going to go over the fundamentals everyone should be familiar with if you're working in the HQM portal that are oftentimes overlooked or forgotten about, even if you've been using it for years, but are crucial when it comes time to submit. So first off is the HQM homepage. This homepage appears when you log on to the HQM portal. The HQM is actually accessed from a website, hqm.nextgen.com. I've had some confusion lately. This is not within the NextGen application itself. But once you do log in, the user will see information such as the client site name, which is important if you're trying to communicate with the NextGen HQM team, since it doesn't always match your practice name. It can, but it doesn't always. So for instance, it's March of 2019, and you may want the CQM 2019 program added to your HQM so you can actually start tracking your data early this year. When you go to request that program to be added to your HQM, you're going to have to know your site name so the HQM team can add it to your specific portal. Next is system messages or alerts. This is huge, especially this year regarding known issues. For instance, the improvement activity bonus wasn't being added to everyone's promoting interoperability submission file. That's about a 10-point difference, so it makes a big impact here on your scores. That announcement was published here on this homepage. The next is the data processing status, which will let the user know if the job is either complete or in progress. It'll show the last process date, or if for some reason no data has been processed. Again, this is important when you're regenerating your reports throughout the submission process so you know when they're actually completed. And lastly, if you have logged into the portal and ran reports before, you're going to see your latest and your favorite reports, which are tracked at the user level. So I do want to emphasize, of those components I just named on the home page, arguably probably the most important one is going to be the job status. So on the home page, if you hover over or click on that processing complete or in progress, the job status quick view panel will appear. And that panel shows the job status in 3 different steps. And it actually uses a color-coded system to show its progress. So green indicates the step is completed. If it's blue, that means it's being executed. And if it's white, that indicates it hasn't started yet. The panel also displays the date that latest piece of data was extracted and the number of days for the data delay. So this is really important when submitting MIPS data using the HQM, as you're going to have to kick off a new job multiple times throughout the process. And this panel is going to tell you when the job is complete and when it ran last. If the job isn't running consistently, your reports aren't going to update to accurately reflect your configurations, which would definitely hold you back from submitting. So to put it in perspective, after a good amount of errors and warnings I've encountered with clients throughout the submission process, I would say somewhere between 80 or 90% were resolved by kicking off a new job. And then the other 10%, they did require a different fix, but then ended up actually needing the job to be kicked off or ran again regardless. So I promise you, you will use this job status view panel at some point throughout this process. With that being said, you might be wondering when your reports are being updated with new data from NextGen. Reports pull from a copy of prod, and data reflected will typically be 1 day behind the last process date. There can be a 14-day delay in pulling data reports. This could allow for completion of encounter data so results aren't skewed. But again, you can reach out to your HQM analyst. They can tell you what you're set up for, and you can also change it through them as well. One thing we do want to stress is to make sure that your report server copy of prod is getting refreshed on a daily basis. If the copy of prod is not up to date, HQM will not be able to pick up current clinical data, and therefore your reports won't be accurate. Again, haven't had too much issues or trouble with this. A lot of times people just want to know when their reports should change or when they should update if they're making changes in the EHR. Now, I did mention that periodically the HQM will display announcements on the homepage. These messages are important and almost always affect the end user in some way. A lot of people tend to overlook these and may not have time to scroll through the alerts, so NextGen did try and make it easy and actually color code them. So if a message is blue, like the one you're seeing on the screen, it contains general information or deadlines. If it's green, that's usually discussing a product deployment or an update. And then if it's red, it's identifying any expected downtime. So obviously these messages take on greater weight during the submission period because downtime and deadlines are so important to plan for, and any updates could contain fixes to known issues that are actually affecting you and your data. Now, I have to say NextGen has done a really great job of updating these with actual important information these past 2 months. When bonuses weren't being added, like I mentioned, or there were known issues that were preventing measures from calculating correctly or even showing up on program submission files, or when CMS decided to take a benchmark away last minute for a measure on January 3rd of this year, NextGen was on top of it. They were letting us know through these updates. So needless to say, they are important, so please take the extra minute to read through them. Speaking of which, I don't see why we can't take a closer look at what's posted on there now. You can see the deadlines that are coming up. The MIPS submission is due by March 22nd. Wanted to point that out because that is creeping up pretty close. Lastly, not only on the home page, but on every page in the HQM, on that top right-hand corner, there's a magnifying glass icon. If you do click it, users can actually perform a keyword search and access measure white papers. And those white papers are going to provide detailed information about program measures, all from within the HQM. So this isn't a new feature. It was added a year or two ago, but it is a huge time saver. Instead of having to open another browser, log into the Success community, search for the correct white paper, and then wait for it to download, this eliminates that need. It gives HQM users white papers at their fingertips. So I can't tell you how many clients ask me, well, wait a minute, how does this measure pull from NextGen into the HQM while we're sitting down and looking at the reports? Because they're questioning if their numerator is correct. Well, all you have to do is search the measure and pull up the white paper, and you'll get the exact numerator specifications that will answer those questions. All right, so done with the basics and kind of intro to HQM and moving on to the actual submission process. Many people don't realize to report under MIPS using the HQM, it does take some preparation. You need to look at certain settings and have a plan in place to be successful. One of my favorite quotes by Benjamin Franklin sums it up very nicely. If you fail to plan, you plan to fail. And that is 100% true when it comes to MIPS. Your HQM settings play a huge part in how your data is collected, and if it is done so correctly, to accurately reflect your practice. So let's start by looking at practice settings, and that's going to be found under config and then practices. And you want to confirm the following. You want to make sure your PHR enable date is shown with a green check mark. If there's a date with an X next to it, that indicates your PHR was enabled at a time in the past and has since been disabled. This needs to be enabled to track the timely access measure. Make sure the correct TIN or tax ID is selected and not showing as unavailable or unselected. This will impact your reports, especially if you're trying to participate in group reporting. Next, manage your providers. You can click on the provider's icon to make sure any provider who you're reporting for is selected and marked as active. And those who maybe have left the practice are marked inactive. This is important for group reporting, especially since all providers need to be configured. Also important to make sure to include all eligible clinician types, such as PAs and NPs. Especially in 2019, clinician types included under MIPS have been expanded, which likely means a lot of you will be coming in here after your 2018 submission and activating any of your OTs, PTs, pathologists, your psychologists, or even your registered dietitian. So this step is crucial, and one of the first things I do when working with the client is to actually sit down with them, go through their provider list, or it will really throw everything off. And I can't tell you the number of times that I've sat down with the practice and they're like, wait a minute, why is this provider marked active? They haven't been here for 3 years. So definitely important to check that list. And then lastly, manage place of service. Really all or almost all of these should be checked to get data to pull correctly. And honestly, they usually always are, but just a second place to check here as well. So you can see in this screenshot, the PHR enable date has a date with a green check mark. The TIN or tax ID shows as one TIN, and it's not unselected or unavailable. And then the icons under providers and POS inclusion are buttons that you can actually click to bring up those pop-up of the list that I went over that you should review. The next two places to check your settings before you even think about submission or even tracking your measures are going to be under the provider settings page and the PI settings. So first, users should check their settings under config providers, and you want to confirm all your providers' NPIs and TINs are verified. If they are not, this is going to impact the accuracy of reports, and it's going to be an issue for submission. It actually won't even let you submit your reports to CMS. You also want to check your PI settings, and you want to make sure that all secure message category types are checked. So if they are not checked and a patient selects one of those message types, when they're trying to send a message to your practice, it's not going to increment the numerator for that secure messaging measure under the PI category. And a lot of times both of these are overlooked. So the top screenshot in the PI settings page on the secure messaging tab, again, these are the message categories that patients can choose from when they're trying to send a message to your practice. They are going to be different for every practice. It's whatever you have set up. You just want to make sure that all of these are checked for them to count for the secure messaging measure for 2018. The bottom screenshot shows what an unverified NPI and or TIN looks like. It's a little bit blurrier because I had to take it from a NextGen example because all of our clients have their NPIs and TINs verified. It will say unverified in red. These all need to be verified before you can submit, or you're going to get that error I mentioned. So just simply click that verify NPI button or that verify override TINs to do so. And then kind of a shortcut here, if you have a larger practice, so you have pages and pages of providers, you can actually click that show unverified button, and it'll show you a shorter list of those who just have an unverified NPI or TIN quickly. So once your settings are in order, you want to look at these final steps for submission preparation. So first, confirm which programs you plan to submit through the NextGen HQM and request setup of those programs. So it seems pretty easy until you realize you have to make some decisions here. Now, you can just have all the programs added to compare, which I will admit I have done sometimes, but most of the time, practices will know if they want to report as individuals or a group. And for 2018, most practices already know if they wanted to use the PI transition measure set or the stage 3 PI measures, because those stage 3 PI measures required 2015 CERT or 5984 or higher. What most clients don't know is if they want to report for quality using PQRS or CQM measures. But as of 2018, you could actually combine them. So I would suggest adding both programs or requesting both programs regardless. Now, once your programs are added, you need to ensure all programs are configured, meaning you have to add some measures here. So for MIPS, this includes the PI measures and the PI self-attestation measures, your improvement activities, and again, your quality measures. Now, the next steps of the submission process you should plan for are going a little bit further than just the setup. It's actually looking at the data and analyzing it. So review your reports to ensure you're meeting thresholds, for instance, like the PI base score, as well as any requirements per CMS. Again, an example here, you have to have at least 6 quality measures, and then of course that you corrected any validation errors. So see, I told you I'd incorporate some program requirements here. I can't resist. But the next step here is going to be review the MIPS dashboard to preview scores prior to submission. This step is bolded for a reason. This is my favorite and most important step as part of the submission process, which is surprising because this was new last year, and it has quickly become one of my very best friends. You absolutely 110% need to check this before you submit. This will show you any red flags and point out issues that CMS and or NextGen may not be aware of. So this tells you what your score will be most likely and shows you the scoring details so there are no surprises when you submit. We will talk more about this step later, but very important and beneficial. And then lastly, review and approve files for submission by March 22nd of this year. This process really hasn't changed. It's the same checkbox and approve button we all know and love. I will still go over it later on, but no major changes there. Okay, so taking a deeper look at one of the steps to submission, which is the measure configuration process, where users can actually alter their reports to reflect the measures they want to report on by adding or deleting them. Now, before you start making all these changes, you need to know how to actually get to the page where you can configure measures. So on that menu bar, just click Config and then Measures. And then on that page, users can either add or remove providers from programs. They can add or remove measures for those providers, and they can also change the reporting periods from 90 days to a full year or however long you're looking for. So these configuration changes are edited and saved by program and practice. When I say program, I'm referring to the quality reports you run for MIPS. So under MIPS, we know there are 4 categories providers are actually required to report on in 2018. 3 out of those 4 are tracked in the HQM: PI, quality, as well as improvement activities. Each of these categories has a corresponding program within the HQM for either individual or group reporting that must be configured to report on. So you can see in my list here that I have a screenshot of, these are all of them added in. So to make any configuration changes, you have to select the program from that program drop-down list. Programs are going to be listed by year in descending order, so 2018 should be at the top. Once the program's selected, you want to confirm your practice selection from that drop-down. The practice selection actually determines which providers will appear. So if you only have one practice loaded in your HQM, this shouldn't be a problem. It should default to the correct one. If you do have multiple practices, if you have 2 or 3 multiple practices that you have listed in here, you'll need to choose the correct one to see the correct provider show up. The providers associated with that practice are going to show up as small tiles that display the number of measures assigned to each provider in a blue circle, and then changes based on the program selected. So if the user clicks on that provider box or tile, a window, which you're looking at now, will pop up, and it's going to show you the list of assigned measures, that provider's NPI, which should have a green background with a check next to it, and that indicates it's been verified, and the reporting period, which can be customized by clicking that calendar icon. So remember, the quality category reporting is 1 full year, whereas the PI and improvement activities category can be any 90 days. So that's where you would change this as well. Another cool feature that's often overlooked on this window is the ability to show or hide measure tags. So you can actually click that check mark found under the calendar icon, and that will make the measure tags appear. Now, you might be wondering what measure tags are. Essentially, they're just small badges down below a measure that give more information on the type of measure that it is. So these tags are going to be different based on the program we're looking at. So for example, the quality programs, those reports are going to show measures as either inverse, outcome, or high priority. These are pretty helpful since for this category under MIPS, you have to have an outcome measure or at least a high priority measure added to actually be in compliance. So these badges make it pretty easy to tell if a provider within that little window, if they have one added. The IA program will have measures that show either a high or medium weighted tag. They could also show a CERT bonus tag. Again, very helpful since under MIPS, this category requires a certain amount of activities based on weight. And then lastly, the PI program will have the measure tag of either base versus performance measure. So base measures in the PI category are required. If they're not met, no credit is awarded in that category. So this was a little bit of a tangent from the actual measure configuration process, but just wanted to point out something here going a bit deeper than just the process basics to hopefully provide you with information that'll make your lives a little bit easier when you're looking at your measures. Back to the actual configuration workflow within the HQM. So to add measures, it's identical for all of these programs. You just have to make sure you have the correct program selected. At the top, click that green plus sign icon, and then that adding measures page is going to appear. You would select the practice, providers, and measures that you want to add, and then user would hit complete to add the measures. Seems pretty simple. Here's a closer look at that. You can see users can actually hover over any measure and it'll display the full measure description. The measure tags can be found below measures. These are the same ones we just went over. Another source of helpful information on this page are going to be those star icons. You can see that in the top screenshot. Those are going to be located on some of the PI measures because they indicate that they're mandatory. They're part of that base score. And those are actually automatically selected as well. If you have selected any measures, it'll highlight it in green and have a check mark next to it. And then kind of a helpful hint here, if you do want to just select all measures at once, which I do for the PI category, or for instance, when you're adding these to providers, if you're doing group reporting, you want to add them to all providers, you can always click that check mark I boxed in that yellow-orange color to select all, or the X next to it actually will deselect all. So again, just making your lives a little bit easier so you don't have to click each individual measure to add them. You can also search for a measure by typing in a measure number or a keyword if you're looking for a specific one. Most of the time this happens in the improvement activities. If you're looking for one that's centered on bilateral exchange of information, you can type in bilateral and that improvement activity will show up. Obviously, if we add measures for a provider, we definitely need a way to have some kind of way here to delete them. So there are a few different ways to do so. So to delete all measures for a provider, you would select the X below the provider's name and then the red X when the confirmation message appears. To delete an individual measure for a provider, select the provider and then click the red X next to the measure in the window that appears. So this is going to remove the measure for that provider and specific program only. An alternative way to delete measures for a group of providers is to change the grouping. So if you click that change grouping button in the HQM, it's going to show your search results by measure participation versus provider name. This is one of the things that's often overlooked. To be honest, I didn't even know about this button until about a year into working with the HQM. So what this is going to do, it's going to allow the user to select a measure in that dropdown, and any provider who has that measure added will appear underneath. Then that red X will actually remove the measure from all providers. So another really easy way to configure measures for group reporting, especially if you're a larger practice and like you said, you have pages and pages or hundreds of providers, this is much more efficient. But don't panic if you don't like this option, if you just wanted to try it out, but you want to revert back to the original grouping by provider name in alphabetical order, you just have to click on that change grouping button again to go back. So as we move forward, we aren't going to look at each of the three categories and the specific surrounding measure configuration since really not much has changed since last year, or there really isn't anything special to look out for when it comes to quality or the improvement activities category. We will take a really brief closer look at the PI category though. This is still pretty easy to go over because everyone should have the same measures added. So there are some exceptions to this and we'll cover those, but in general, for most clinicians, you should have the following measures added to your PI program. And those are the measures that you see listed in that screenshot. Now, this only applies if you're not claiming an exclusion for any measure. And of course, you're reporting under MIPS, not Medicaid, which should be the vast majority of you on the call. Now, even if you are familiar with MIPS and the program requirements, something unique to the HQM are the self-attestation measures. These were added as a result of the added functionality to submit your meaningful use data to CMS instead of that manual attestation done through the portal that we used to have to do. So these self-attestation measures are reported as a simple yes attestation. They're not calculated using any EHR data. This process has changed from last year. So these measures have been added to the config measures page in the same way that standard measures are added that we just went over. So if you remember last year, you used to have to go under PI settings and then navigate to a certain tab at the end. And then there were two drop-down menus and options and a bunch of different steps that took up a lot of slides last year in this presentation. Well, not anymore. NextGen has streamlined this process and made it much easier. And in my opinion, it just makes more sense now. These are extremely important because all practices will need to add the following measures or you're going to get an error on your PI program submission file, which will prevent you from being able to submit. So you'll have to add the ONC direct review, prevention of information blocking, and attesting yes to having a security risk analysis on file for that year. So you may remember back in the day when you logged into CMS portal for your MU attestation, you had to click yes multiple times in order to even enter the portal. There were these pop-ups that kept coming at you. Well, those were the pre-attestation measures you're essentially saying yes to by adding them to your report here. There are a few other ones. You only want to add the specialized registry reporting, syndromic surveillance reporting, or the immunization registry reporting if you're actually participating in these and you're in active engagement. You also only want to add either the low volume permissible prescriptions to claim an exclusion for the e-prescribing measure, or the low volume outgoing transfer of care to claim an exclusion for the HIE measure. And then a special note here, when you are assigning attestation measures, it's the responsibility of the provider to ensure they have the supporting documentation to verify they meet them. So this can be anything from a letter from your specialized registry, a copy of your security risk analysis, etc. Really any documentation to support these yes attestations you're going to want to keep. And NextGen even added the little disclaimer here that you have to check before you add them to your report, verifying that. Now, just like last year, the required self-attestation measures cannot be removed once they're added by the end user. What has changed is that the other optional self-attestation measures, so think the HIE exclusion, specialized registry, etc., they are actually being able to be removed this year by the end user. I'm pretty sure this was a self-serving act by NextGen. I mean, I know they had to have been tired of hearing from me last year and any other client when someone may have accidentally added a measure or changed their mind about claiming an exclusion. It was a pretty big inconvenience, I'm sure, on both ends to have to reach out to the HQM team to remove that measure. So this is great news. And then finally, what I will call a pro tip here, after 20 plus submissions this year, I figured out before you can assign the multi-registry self-attestation measure. So if you're in active engagement with multiple specialized or public health registries, you must first assign the provider the single specialized registry measure, then delete it, then add the multi-registry measure on. I'm still not sure why or if NextGen will correct this, but if it's been driving you crazy like it did for me for a while, that's why it won't add. There you go. Now, once these measures are added to the report and it's regenerated, the user is going to see a special note at the top, basically saying all self-attestation and bonus measures are going to show at the end of the report. You can use those arrows to navigate to the last page, and then you should see the list of measures with an attestation status of yes. Again, these aren't going to show up right away unless you've kicked off the job. So this is one of the reasons of knowing how to check the job status on the home page is important. To make sure that these show up on your summary reports, but also on your program submission files. If you do download your reports as an Excel document like I do, or export them that way, these are actually going to show on sheet 2 and using those tabs at the bottom of the Excel worksheet. That's how you'll see them once you export them. Now, I pointed out that there were measure exclusions available to add on that self-attestation tab. If you claim either measure exclusion for e-prescribing or the HIE measure, you're saying that you have less than 100 in the denominator for that measure during that reporting period. Now, I do want to make very clear, you do not have to claim an exclusion if you have less than 100 in the denominator. It is just an option for those that had a 0 in the numerator and would not have been able to get credit in the PI category otherwise. So by taking an exclusion, it's allowing you to fulfill your base score to actually get credit in the PI category, but it will not count towards your performance score. So a very helpful tip I can offer you here, gained from issues submitting last year. Number 1, you're going to have to remove the original measure, HIE or e-prescribing, on that measure config page for any provider you're claiming the exclusion for, or you're going to get an error on your PI program submission file. So you can't have the e-prescribing measure and the e-prescribing measure exclusion on there. It's one or the other. I do want to point out as well, if you have less than 100 in the denominator for either of these measures and you choose not to claim the exclusion, because you have data in the numerator, you're still going to get a warning on your program submission file letting you know you can claim one. You can just ignore this. It's a warning, so it's not a hard stop. And you can still submit, just don't be surprised if you see that. And a personal recommendation coming from someone who wants to get you guys and your practice the most points as possible to get the highest incentive as possible. If you have any data in your HIE measure numerator, don't claim the exclusion. You are giving up points by doing so. So even if you have a 2 out of 10, 3 out of 10, or 10 out of 10 for the HIE measure, if you have a 10 out of 10, you're earning 20 points. If you claim that exclusion because you're looking at your denominator, it's under 100 and you think you should, you're giving up 20 points. So I suggest only claiming the exclusion for the HIE measure if you show zeros in your numerator, and you have to. But again, personal preference. You will see a warning on your program submission file if you do that. Again, that's okay. You just have to go ahead and approve it regardless. And then lastly, nothing has changed or is category specific for the quality or IA categories, so we left those out. But if you do have your improvement activities configured and one of them shows that CEHRT bonus tag, you're going to receive bonus points in the PI category. And I suggest everyone try and pick one if they can to get those bonus points. So that IA bonus using CEHRT is going to show up automatically on your promoting interoperability report after you add the improvement activity and regenerate the reports. So this is important. The bonus will not show up unless both the PI and IA reports are regenerated after the activity has been added. And again, this regeneration has to occur before you submit, or else you won't get the bonus points. This is a big deal. Last year, CMS even released a press release that a bunch of providers were submitting improvement activities that were eligible for those bonus points, but they weren't getting them because they weren't on their QRDA or submission files. So the HQM will actually let you see it. It's added to the bottom of your summary report as well as your program submission file, which are those 2 screenshots you're seeing. So make sure you regenerate your reports after you add those activities, and you see that bonus as a line item. Now, after you've ensured your settings are correct and your configurations are complete, there are 2 important steps or actions you need to take prior to submission. The first being, dare I say it again, regenerating your reports. Like I said, there are some decisions you're going to have to make that will vary by each practice, but there is one thing that remains consistent, and one thing I can tell you with 100% certainty: at some point in this measure, configuration, and submission process, you're going to have to regenerate your reports. So programs can actually be regenerated when one of the following conditions is met. I'm not going to read all of them because the first 2 are going to be the primary reasons why your programs will be ready for regeneration and or why you're going to actually want to regenerate them. So it's going to be whenever you add a measure or remove a measure to providers, or whenever you modify the measure periods or the reporting periods. So to actually regenerate a report, you just go into Reports and click Regenerate Report. You're going to see a list of reports that are eligible to be kicked off. So if you made those changes of the reporting period or adding or removing measures, you'll see them in this list. If you see orange, it indicates that changes were made to that program and you can regenerate them. You'll click a looped arrow icon to regenerate the report, and then a green circle with a check mark indicates that the report regeneration is completed. Now, here's something important. Reports are actually going to be disabled for 2 hours after they're regenerated. So if you kick off your promoting interoperability report at 9 a.m. because you added measures, you won't be able to kick off your promoting interoperability report or your quality report until 11 a.m. if you make other changes. So you make those PI changes in the morning and then you realize, oh, you know what? I actually wanted to add a few more quality measures to my quality programs at 10 a.m. You won't be able to kick off any reports until those 2 hours are completed. So just kind of a time frame to keep in mind, especially as we get down to the wire with submission. If you're trying to do everything in one day, this may hold you up. And once your reports are regenerated with what you think are your final configurations, it's time to look at the MIPS dashboard. The MIPS dashboard, like I said, it's not new this year. They've just actually revamped it a bit to be a very useful tool in the submission process. So what this does, it's going to allow providers or users to monitor performance in those MIPS categories via real-time feedback from CMS. So the dashboard displays provider performance data at both the individual and the tax ID or group level for any generated submission files prior to submission and after. Now, what I do want to throw out here as sort of a disclaimer is that this score is only a preliminary score. It's not your final composite score. This is a very, very, very good indication of what your final score will be, but there's always a disclaimer that it may not match exactly with your final score, that you should get back in a feedback report in July. So to check the MIPS dashboard, you just go to the HQM homepage, you can select reports at the top, and then the MIPS dashboard at the very bottom. So the MIPS dashboard provides the following information in sortable columns. You'll see the provider name if you're looking at individual reporting. If it's a group, you're not going to see that. You'll just see the tax ID. And then you'll see the status, your improvement activity score, your promoting interoperability score, your quality score, and then your total composite score, and then the evaluation date. The status will show you if the file would be rejected for some reason by CMS, and your eval date is going to be the date of the last HQM evaluation. Notice at the top, you can toggle between group and individual using the drop-down menu and then clicking the green load button. Now, when viewing the dashboard, you can view two types of scores, preview score and submitted score. Preview scores enable you to see your initial MIPS performance category scoring based on your measures data. Again, the HQM portal is doing this by periodically reporting your measures data through the CMS Submissions API. The submitted scores are going to show after you approve your program submission files. So to kind of toggle between these, if you have submitted, you would use that score type dropdown and select submitted and hit load again. New this year, the dashboard actually takes into consideration small practice adjustments for the IA category and the total score, as well as special statuses for the PI category reweighting. This is extremely convenient, and it gives most users a greater sense of relief. I know it does for me. For instance, I know last year it was really nerve-wracking to see your improvement activity score stay at 7.5 if you only submitted half of the required activities because you're a small practice and that's all you needed to do. This takes the worry away, and after you submit, that 7.5 will now jump up to a 15. It takes those small practice considerations into account. The same idea here, if you are a small practice and you submit, this will automatically add an additional 5 points to your total score. That's a CMS rule for 2018 only, but this scoreboard again takes that into consideration and automatically adds that. So you're getting a much more accurate representation of your score. Now, one thing I will point out, the MIPS dashboard does not track anything to do with the cost category. So whatever your total score says, you're going to want to add anywhere from 1 to 10 points to it for your actual final score. This data is not tracked at all by the HQM. You actually don't even submit anything. CMS is collecting data from your claims throughout the year. And we don't have any idea how you're doing on this category until July 1st when CMS releases those feedback reports. So the highest score you could get on the MIPS dashboard is a 95. That's a perfect score of 15 points for the IA category, 25 points for the PI category, and 50 points for the quality category, plus an additional 5 if you're a small practice. So if you're not a small practice, meaning you're over 15 clinicians, the highest score you'll see is 90. So you can see that high score in the screenshot above here, that example I have. They're getting a perfect score in all 3 categories based on the data and the category weights. If this practice was a small practice, once we approve the submission files, that total score would jump up 5 points automatically once we use that toggle at the top to change the score type to submitted. Now to see the total view and get even more information, you would click that total score button. You can see the preview score breakdown, and then you would click that little gray bar with the graph symbol, and you can actually see historical trending data for summary reports. Now, I'm going to be completely honest with you. I have never really used that trending data or that little graph icon with clients. Why I come in here, why I click that total score, is to access the score details. This is the gold mine of information to check your scores, understand your scores, and identify any issues. So for even more information, if you click that total score, then click on the category in the pie chart. So anywhere I have outlined in that yellow color, so specifically here, the quality category, you're going to see your detailed score from CMS. And this is all before you've even submitted. This is your preview score. So this is what's called the response file. It's going to show you the exact number of points assigned to each measure. So even if you enjoy benchmarking your own data, and yes, go ahead, have a good laugh or look appalled. Those are usually the two reactions I get most often. But when you benchmark your data yourself using that spreadsheet from CMS that they posted to the QPP website, you only know to the nearest whole number what a measure's assigned point value is. You won't know if you're actually earning 8 points or 8.9 points. And those in-between numbers end up making a pretty big difference. So you can see this file lists the measure number and then says contributing 3, and that means 3 points. Now, I couldn't use a real file, it had too much client information, but we definitely wouldn't want to choose measures only earning 3 points. We're looking for those contributing like 8 or 9 points. But when you're looking through your file, you may notice some measures might say contributing 11 or 12 points, and that might cause you to second guess, wait a minute, measures are only out of 10 points. And that's because they actually include bonus points for additional high priority or outcome or end-to-end reporting. On the flip side, if you've actually configured more than 6 measures, so let's say you have 7 or 8 quality measures configured, because you wanted to use those as extra to add bonus points, those measures underneath it will say skipped, but contributing 1 or 2 points in bonus. So bottom line, this is extremely helpful with the quality category since benchmarking is very difficult and never exact when you're performing it manually. And as I mentioned before, this is an awesome tool to alert you of any changes. So for example, CMS decided to remove Quality ID 226 benchmark on January 3rd, 2019. So we were tracking Quality ID 26 all throughout 2018, and they changed it on January 3rd of this year. Now, I know I've mentioned it before, and it may sound like I'm holding a small grudge, which I am, but I would not have noticed unless I checked my client's MIPS dashboard and saw instead of earning a perfect quality score, they were earning lower than expected. And I did this before we submitted. So I was able to go into these score details and see where I predicted 10 points for that measure, 226. For some reason, CMS was only giving them 3. Did a little research and found the issue. Similar issue happened. The quality score was lower than expected from what I had manually benchmarked prior to submission. I clicked on the score details and I realized for some reason the CQM CMS 65 was missing completely from this file. It wasn't showing up anywhere. I worked with NextGen and we actually identified a known issue that measure wasn't generating on the program submission files for anyone. That has since been resolved, but as you can see, I've kind of taken it upon myself to kind of idolize this MIPS dashboard, and I've started comparing it to what I remember as the check they used to teach you kind of in high school algebra. You go back and you sub the number in you got for X into the equation to confirm you got the right answer. This is that method, just a lot easier for MIPS. It will confirm your numbers are accurate, or it'll at least help you identify any issues you might be seeing. Also new this year is the requirement to select the MIPS components you want to include in your QPP submission file. So you actually do this from the MIPS dashboard page by clicking on that little gears icon or button. So what NextGen does is they send one submission file containing all of your performance data to CMS based on the programs you choose to include. So for the quality category, providers can report on measures using both PQRS and CQMs. You can see that you have the option to configure both. They're those square check marks. Now the user must select either group or individual and either PI or PI transition objectives. So you can see those two are the 2 radio buttons that you can only select one. So this is kind of an added step here you need to make sure that it's configured correctly. And again, I mentioned you can have both the CQM and PQRS files configured and submit using both because you can combine the measures this year. Well, if your submission file is configured to include both of those, the MIPS dashboard will, again, help you detect any overlapping measures. So what the user can do is view any configured measures from the dashboard by clicking that red magnifying glass. It'll show you a list that pops up, which is the screenshot you're seeing, and any overlapping measures will show in red. You cannot submit any overlapping measures to CMS. So again, you can see that quality ID 7 is overlapping with CMS 145. You can't have both of those configured. So again, just another function this dashboard serves as kind of a final check before submission. Speaking of submission, I'm sure most of you never thought we'd make it here. Moving on to this kind of actual submission process, not much has changed with this. There's just one or two updates I wanted to share with everyone, especially if you receive an error when you submit. So good news, not only has it not changed, it's also identical for all three categories under MIPS using the HQM. So going through these steps here, you're going to do the final measure configuration, regenerate reports, generate the program submission file, review that submission file, correct any errors and warnings, and then approve. Just quickly going through how to actually generate that file. We can kind of skip ahead to that number 3. To actually do this and have access to this, you need to make sure that you have the client admin role in the user management. If you don't, this won't show up for you and you won't have the privilege to actually go in and do this. So you go under admin, program submissions. This program submission page displays, and then you'll have to click the Generate Medicare QPP button. It's the blue one with the gears. Once you click it, it'll turn colors to gray and it'll say generating. And you need to do this for each one of the categories that you're submitting data for. So that means you're pressing that Generate Medicare QPP button 3 times for the PI, for the IA, and for the quality file. Once they actually generate, you're going to see what I have kind of outlined here in yellow. This will show you the number of files you've generated. If you're doing group reporting, it should only be 1. If you're doing individual reporting, it'll be however many providers you have configured. It'll also show you the total number of warnings and errors displayed. They'll pop out in a color here, as you can see. If you don't have any, it'll show 0 and it'll stay white. You need to go ahead and view these files. So you click that View File button. And then what you'll see pop up here, you'll see a file name, the status, view file, and then alerts. If there are any alerts, you'll see that orange exclamation point. So you can actually view the JSON file contents to confirm everything's correct. Obviously, I redacted any practice information here, but you want to double check each line item compared to your summary report for the measures. You also want to double check that your NPI and TIN are correct here. You're looking at things like, for instance, that IA bonus that I said should be a line item, or your self-attestation measures, your security risk analysis. You should be checking all of these line items to make sure they're there. You can see above the report there's the option to print or download this. It does only open in Notepad. It's not formatted, but you do have the option to do that. And you can see to the right, errors and warnings will display if you have any. So looking at those errors and warnings, stay calm. They can be fixed if you have any. They can occur for various reasons. The errors are the more serious of the two. They actually prevent you from being able to submit and being able to see a preview score in your MIPS dashboard. So some of the kind of the most common errors I've seen while assisting clients submit are going to be on the PI report. It'll say the provider has not met the base measures. So what I found is that oftentimes maybe the self-attestation measures have not been added and the job hasn't been kicked off. Another error on the PI report is having both the e-prescribing measure and the e-prescribing exclusion added. You can also have both e-prescribing measures added. So NextGen gives you the choice between e-prescribing include narcotics and e-prescribing exclude narcotics. You have to pick one. And then kind of lastly here on one of the quality reports, one I've seen, it says TIN does not include all providers with matching TIN. This means that all of your providers weren't configured with the same measures, or you don't have all the providers that you have marked as active configured. So You guys are seeing kind of why those settings we looked at in the beginning are important and where they'll come back to haunt you. It's kind of like we're coming full circle here. Who would have planned that so perfectly? But now looking at the program submission file warnings here, like I said, these are more just the friendly reminders. These aren't hard stops. You can submit. So again, that warning I mentioned, if you don't claim the exclusion and you have less than 100 in the denominator for e-prescribing or HIE, this will come up as a warning. That's okay. You can ignore that. Kind of a similar warning here is on the quality report. Sometimes it'll say provider has less than 20 in the denominator for a measure. Now that warning we do want to pay attention to. If you have less than 20 in the denominator in the quality category, that means you're only going to get 3 points no matter what for that measure, even if you're scoring 100%. That's the case minimum. So that one we would want to pay attention to and we would not want to ignore. Now, before you can approve a file, like I said, you're going to have to resolve all those errors, and then you'll have to actually request evaluation and regeneration. And then, obviously, this regenerate button, you can see after you generate the first time, if you ever do need to regenerate it, it will be next to the download button. Now, once you've got a program submission file with no errors, you should, again, like I said, review the contents, but to confirm everything's correct, all you have to do is check that checkbox and then hit the approve button. Submission usually happens almost immediately or within like 3 to 5 minutes. It does say within an hour. It really depends on the number of files that are queued up and the load time to CMS. But once it is approved, you can see it'll list the client admin username that approved the file and then the date it was approved. And I have a ton of clients ask me, how will I know when it's submitted or when it's accepted by CMS? Well, on the old CMS portal, we used to get a notification saying it was accepted. Now what you're looking for in that top screenshot, once it's approved by the user, it'll turn green. That's status. You'll know CMS has accepted it and it's officially submitted when that status bar turns blue and it says submitted. And then it'll actually say the CMS batch ID. That ID, this is what you want to take a screenshot of. That ID is important because if you ever had to call CMS, knock on wood, I haven't had this happen, and reference your files, you need to give them that batch ID number. So like I said, it really depends kind of on where you're at, date and time of how many files or how much activity is going on with the CMS servers, but I would say anywhere between like 3 to 5 minutes, that status bar has been changing just by refreshing the page. Now, there is always the possibility your files are rejected. Knock on wood, again, I have not had this happen. Rejected files will display with an error for rejection. You will need to make some corrections and resubmit and talk to your HQM analyst, but that'll show up not as blue, but a red status that says rejected. Now, after you submit and get your screenshots with your CMS batch ID, your next step should be going back to the MIPS dashboard and then view your scores for the submitted files. So after you actually approve the files, you want to go back, toggle that score type at the top to submitted. The status should reflect OK. If the file has an error status, you'll see that. And you can actually click on that to see the error details. And then it's going to show you your submitted score that should take into account those variations for small practices or special statuses. Now, if for some reason CMS encounters any errors as it evaluates your measures, it will return the error details in your feedback along with your performance scores. And you can actually see it has a send email button. If you click that and you type in your HQM analyst email, it'll send it directly to them to work with them. Now, one thing I do want to point out for 2018, if your MIPS submitted dashboard score says error and you click on it and the error says and matches exactly the screenshot, error detected in APM section of provider data, for about the past 3 weeks, any client that I've helped submit has received this error. I reached out to the HQM team lead and he let me know a lot of clients are getting this error and it's okay. He also forwarded me an email from CMS confirming the files have been received and there's no additional action required. So what you're seeing on this screen is what the email specifically from CMS said. So basically, This APM eligibility information for legacy systems sometimes isn't crossing over correctly, and this is just a warning and what that's explaining. And that most importantly, no action is needed on behalf of the client. So it stinks. No one wants to see a big red error status on their MIPS dashboard, but I have been promised that this is okay and you can overlook it. Now, if you get an error and you click on it and the message does not match this exactly, it is not okay, and you do need to let someone know and possibly resubmit. And lastly here, kind of our last slide, just to wrap things up before you can get rid of me, I just wanted to talk about my recommendations for your audit binder. And yes, you still do need one in case of an audit. You're going to want to include your final HQM reports, those summary reports, as well as the provider patient report or practice patient reports. Those are new this year. To add, it's basically going to include any treatment opportunities, any exclusions or exceptions for that denominator data. So run those for your PI and quality measures, or quality categories, excuse me. Screenshots of both your preview and submitted MIPS dashboards, screenshots of those successful submission with your CMS batch ID statuses for each of the categories. If you have any special statuses of like small practice, or let's say you're a hospital-based clinician, go on the QPP website, type in the NPI, and take a screenshot of those special statuses. You should keep a copy of your security risk analysis on file, any documentation if you're reporting to a specialized registry, and then anything else pertaining to MIPS. If you ever reached out to the CMS help desk and they emailed you a response back, keep that. If you applied for a hardship application, you should have an email confirming that that was received. Any information dealing with MIPS, you really want to keep in an audit binder, either printed out on paper or electronically in a folder, whatever works best for you. But it looks like we made it to the end here. If you are uncertain where your practice stands, you can always let I-10 help. We actually do offer macro support packages where you would be working with me directly on this. I promise I do not actually talk this much when I'm on client calls, like I force you on these presentations, but we can kind of sit down and see what package is best for you, and we will be sending out this flyer with a copy of the slides and the presentation recording as well, so you can look at the packages offered. The macro fundamental seems to be the most popular right now with submission, but we will include that info. New this year, we also have the MIPS scoreboard. This was actually created by I-10, but it's actually a NextGen product now. This is an awesome tool to have on your side, kind of helping you out. It functions very similarly to the MIPS dashboard within the HQM by providing automated scores, but it definitely goes many steps further, including treatment opportunities, as well as letting you know how many encounters you are away from a certain number of points, laying out treatment opportunities in a way that once you're in one encounter, you can kind of hit all measures that you're missing out on. It offers visualization of data and graphs there. So if you're interested in seeing a demo, let us know, shoot us an email, and we can definitely get that set up for you. But otherwise, visit our website, keep signing up for these webinars, and always test drive our products. So it's finally time for questions. I'm sorry I went a little bit over, Chelsea, but I will turn it over to you.
Wow, Lindsay, that was a lot of information. Great job. I'm impressed you didn't lose your voice. Again, if you guys have any questions, you can, I know, great job. If you have questions, you can type them in the questions area of the webinar control panel. We only have 2, so if you have questions, we'll stay on to answer them, so just type them in. First question, you said the max score is 95, but the max score without cost is 90. Cost is worth 10 points out of the 100.
Yes, so when I said 95, I should have been more clear, I apologize. If you're a small practice for 2018, CMS is giving you a free 5 points to your total composite score, which is pretty nice of them. So a 95 is the highest score you can see on the MIPS dashboard if you're a small practice, because as you said, the other 3 categories, PI, IA, and quality, add up to 90 points. But if you're a small practice, you'll add in those 5 points. So 95 out of 100 would be the highest score if you're a small practice you would see. And then cost could make up those other 5 points. But again, if you are not a small practice and you're under or you're over 15 clinicians, you won't have those 5 points added. So you are correct. The highest score you could see in that scenario would be a 90.
Great, thanks for that clarification. Next question, will the PowerPoint be available after the session? I'll take that one, Lindsay. Yes, it will be. I'll be sending out an email to everybody who registered for the webinar within the next week with a link to the recording, a PDF of the slides along with that flyer that Lindsay was just talking about. So
yes,
it
and
looks like
if anyone needs help, sorry, I just want to let anyone know, if anyone does need help with 2018 submission, please reach out to us as soon as possible. There is definitely still time to help you guys and kind of get you guys turned around here. I've been still getting new clients even this week or so and getting things turned around within a week of helping you guys get submitted. So feel free to reach out to us if you need 2018 assistance as well.
Oh, looks like we got another question, Lindsay. For the secure messaging measure, what would you recommend? What would you recommend messages should be included? For example, is it appropriate to include billing questions?
So that is going to be up to each practice. The idea here is whatever a secure message type is checked, you can leave out certain message types if you want. So if you don't feel comfortable saying billing question is as a secure message, you don't have to check it. But just know if for instance, your message categories are listed in alphabetical order, we know patients, they might just pick the first option in your dropdown. And maybe it is actually a medical question that they put under billing question. That's not going to count as a secure message to your practice. So it really is up to the practice what they want to check as a secure message. I will leave that up to you to decide, but just know if it's not checked, it will not increment your numerator.
Thanks, Lindsay. We got another question. Is it possible to get the slides sooner since submission is right around the corner? You know, that's a great idea. I will bump this up to the top of my list and get it out to you as soon as I can. I will get it out at least by the end of the week, hopefully a bit sooner. Okay, well, that's it. If you have any more questions, if you think of anything, you see Lindsay's information up on the screen. I'll be sending out the email with the slides and all that stuff, so you can always reply back to that email as well, and I'll make sure that Lindsay gets it. Again, remember to shoot us an email if you have future webinar ideas, and thank you, everybody, for joining us. Oh, we got another one. Is there a denominator minimum for the PI?
Nope, so there's no case minimum, which is nice for the PI category, just for the quality, that's 20. For the PI category, the only kind of denominator threshold that matters are those two exclusions. So if you're under 100 for the e-prescribing or HIE measure, you can claim the exclusion, but you don't have to. But nope, no case minimum.
Okay. Lindsay, anything to add?
Nope, I think that is it. If anyone does need clarification, I know I talk a mile a minute on these webinars. Like I said, feel free to shoot me an email and I can try and type it out. I'm a little bit more concise via email versus when they just let me rant for an hour, but I hope you guys enjoyed it, and absolutely thanks for attending, everyone.
Thank you, everyone. Have a great week.